All right, so there are some specific poisons that we see over and over, so we're going to study those a little more closely. So a person who routinely misuses a substance may get more and more, get to the point where they need more and more of that substance to get the same effects. So we call that a tolerance. If you're a coffee drinker and you remember the first time you ever had 1 cup of coffee and you're bouncing off the walls, and now you have to have 3 cups of coffee to even have the energy to brush your teeth in the morning, you've developed a tolerance to caffeine. Same thing with sugar. The first time you ever had candy, you probably were bouncing off the walls. Now you can, eat a whole chocolate bar and everything's fine. That's because you've developed a tolerance to caffeine or sugar. A person with an addiction has an overwhelming need to use that substance at whatever cost. So, if they have to injure somebody else in the way of getting that substance, that might be something that they consider. So we have to be really careful about our safety when we know we're dealing with somebody who has a tolerance or abuses a drug. So almost any substance can be abused. Like I said, I use coffee and sugar as an example because most people can relate to that. The importance of safety and awareness is just huge on these calls. When somebody's been poisoned and we know it was a drug abuser, we're still going to treat them with respect. We're still an advocate for them. We're still going to do everything we can to help them. But we're also going to be really careful because there's a higher chance there could be needles laying around. The person could have HIV, hepatitis, other infections like that we could catch. So we just assume everything is infectious. You really shouldn't be doing anything different on these calls, but expect the unexpected and keep a closer eye out for things like needles and syringes and things that could expose you to either their germs or to some sort of poison that you wouldn't want to be exposed to. Okay, opioids. So opioids are a narcotic medication. They're a pain reliever. It's a subset. Opiates are subsets of the opioid family, and they're just natural, non-synthetic opioids, and they're named after opium and poppy seeds. So if you've heard of codeine and morphine, this is where those came from. There's a bunch of other names you may not have heard: meperidine, hydromorphone, oxycodone, hydrocodone, methadone, Stadol, codeine, fentanyl, sublimase, heroin, Vicodin, Dilaudid, morphine, methadone, oxycodone or oxycontin, Opana. These are all opioids. Okay. Prescription opioid drugs are among the most commonly abused drugs in the United States. A lot of people get prescribed an opioid for a legitimate reason. They have a knee surgery or they dislocate their shoulder and they're prescribed opioids and they take them. And then they get physically dependent on opioids. I was listening to a podcast a while back where I forget who it was, but they were saying they had like a shoulder injury or something and they started taking opioids and they took them for 3 days because their shoulder was hurting really bad. The 4th day, they got out of bed, their feet hit the floor, and their first thought was, oh, I need to get my Vicodin or whatever it was. I need to get my opioid. And then their second thought was, my shoulder's not hurting. My brain was just telling me that I need my opioid. It's that addictive. We're talking 3 or 4 days. And so if somebody has a big surgery, they may be on opioids for several weeks or even months sometimes. So they can get physically dependent on those opioids while they're following their medical prescription. They're just taking however many pills a day like the doctor told them to take. So that's how a lot of people get addicted to opioids. The death rate from heroin overdoses tripled from 2010 to 2013. And then from 2013 to like 2018 is the latest data that I've seen. It like tripled almost again. And now it's leveling out, which is not a good thing because it's leveling out extremely high. So this is a really big problem. Opioids are central nervous system depressants. They can cause respiratory depression. So basically what an opioid does is it causes a person to stop breathing. And then if you're not breathing, well, your heart gets deprived of oxygen and then you go into cardiac arrest. So what causes the death is just they stop breathing. Opioids cause a person to develop a tolerance really quickly. They need more and more and more very fast. So a lot of users need a big dose to get the same experience. They cause nausea and vomiting. They can cause low blood pressure. They basically cause everything to slow down. Seizures are uncommon, but they can happen. If you have somebody with an opioid overdose, they're probably going to appear like they're asleep. They're either sedated or unconscious. You can't wake them up. Their skin is cyanotic because, again, they're breathing really slow, and the pupils will be pinpoint. So pinpoint pupils, just breathing really slow, blue skin because they're not getting enough oxygen. They could be breathing like 3 breaths a minute if they're still alive. So we do have an antidote for opioids. It's called naloxone. You've probably heard it called Narcan, which is the trade name. As EMTs in Montana, we cannot give naloxone or Narcan. If you want to be trained to do that, you can get an endorsement at the EMT level, and you can even get an endorsement if you're a first responder or emergency medical responder. They have an endorsement, but you have to get that endorsement, and then the endorsement will allow you to give it intramuscularly or more commonly intranasally. Anybody above the EMT level, where they have the medication endorsement or they're an advanced EMT, they can actually give it intravenously, intramuscularly, or intranasally. Here's the big thing about giving Narcan or naloxone. You should only use it when the patient has agonal respirations or no breathing. So we're going to wait until they stop breathing on their own. If they're still breathing on their own, we're going to use a BVM and help them breathe to keep them alive. If they stop breathing completely, that's when we'll give them the Narcan or the naloxone. You just want to wait until they've stopped breathing before you give it. You should always use a BVM to help them breathe before you give the naloxone. And if you're using a BVM and they're unresponsive, you should put in an OPA to keep their airway open. One thing to keep in mind is that in a lot of areas, including Montana, this is what's funny about Montana, we have to have an endorsement to give it as an EMT, but a layperson can just go to the pharmacy and buy it, Narcan or naloxone. So you may show up to a scene of a patient who has overdosed on an opioid and someone's already given them Narcan or naloxone. So make sure you ask the bystanders, was the patient given anything? Did you see him put anything in their nose? Even if, maybe the bystander gave it and left. Okay, other things you might come across in the field, cholinergic agents are nerve gases. So these are usually used more like in chemical warfare, but it basically causes stuff to pour out of everywhere. So salivation, drooling, mucus oversecretion, so runny nose, urination, diarrhea, tearing of the eyes, abnormal heart rate. So basically it's going to cause stuff to pour out of everywhere. Some people use the mnemonic dumbbells to remember that. Again, it's just stuff pouring out of everywhere. Crying, puking, pooping, slow heart rate, pinpoint pupils, seizures. Some people use sludgeum. Same thing, stuff pouring out of everywhere. Sweating, diarrhea, gastric upset, muscle twitching, vomiting, all those things. They've been exposed to a nerve gas. You want to avoid exposure yourself, just like any other poisoning. So they may need to be decontaminated before they're treated and transported. Hazmat will do the decontamination and make sure that you're not exposed to the chemical. After they've been decontaminated, they're like drooling and vomiting and everything. So you probably need to suction the airway in order to help them breathe. The antidote, there is an antidote for nerve gases. We don't carry it on the ambulance. It's typically stored at armories, and then it will arrive to the scene of the event when it happens. So I think there's 6 hours from anywhere in the United States. Most likely we probably have one here in Missoula because we do have the armory here. I don't know that for a fact, but we are kind of the center if you think about Flathead and all that stuff. For it to be within 6 hours of everywhere, this is a really good spot. So I'm guessing we have it in Missoula, but who knows? It's called the Duodote auto injector. It's just like the EpiPen. It's an auto injector that you just jam into their thigh, and it'll reverse the symptoms. So if you are given that Duodote auto injector, if you've been exposed to the nerve gas, give yourself a dose first, and then you'll just start giving everybody else the Duodote auto injector. Other drugs people may come across, one thing that's becoming common is cardiac medications with children and with older patients. And so, grandma and grandpa get their heart pills mixed up. One's supposed to speed up, one's supposed to slow down the heart rhythm, and now we have a real problem. Or somebody drops a pill on the floor and grandchild picks it up and puts it in the mouth. So you just want to be alert for that. If somebody has a sudden, low heart rate or fast heart rate, you might want to ask if they've taken any different medication, or if they possibly got their medications mixed up or took too many or forgot to take it or something like that. The signs and symptoms, again, are going to depend on what the medication they ingested was. Call poison control, and maybe you can give activated charcoal. You're going to want to know what they took, when they took it, how much they took, if they've eaten anything before or after, and all those kind of things before you call. Aspirin poisoning can also be lethal. Aspirin can cause nausea, vomiting, hyperventilation, ringing in the ears. Anxiety, confusion, fast breathing, hyperthermia, where they get super hot. They could have seizures. You can overdose with Tylenol, acetaminophen, and that one's a really common one. Whether it's intentional or unintentional, it has to be treated promptly and aggressively. Alcohol. Some alcohols are even worse than drinking alcohol. So people will drink, rubbing alcohol or things like that, and it can cause blindness. It can cause the renal failure, which is the kidneys shutting down, and it can cause death. Food poisoning usually comes by eating contaminated food that's been contaminated by bacteria. So either the bacteria itself causes disease or the bacteria produces toxins that cause disease. So you've probably heard of salmonella before. This is a common bacteria that causes food poisoning. With salmonella, they'll have nausea, vomiting, and abdominal pain and diarrhea within 72 hours of ingesting the food that caused the problem. As long as everything is cooked properly and we prevent cross-contamination, it's pretty unlikely to get salmonella. It's uncommon for that reason. The more common cause of food poisoning are the toxins that are produced by the bacteria found in leftovers. So Staphylococcus is an example, especially if the food is left unrefrigerated, if it was left out and that bacteria starts to grow and produce toxins. Usually with this kind of food poisoning, the person will get symptoms within a couple hours. It could be up to 8 or 12 hours after ingestion, but it's probably going to be that same day or that same night. The most severe form of toxin ingestion is called botulism. This comes from improperly canned foods, and it actually affects the neurologic system. So blurred vision, weakness, trouble breathing, trouble speaking. Don't try to figure out the cause of somebody who has acute GI problems. Get them to the hospital, get their information. If they think they know what made them sick, bring that food to the hospital so it can be tested. Plant poisonings, you'll never know all the different household plants, but what you need to know is that many household plants are actually poisonous if people ingest them. So if a toddler is suddenly sick and they have some redness around their mouth, check out the house plants and see if they're missing a piece that could have been eaten by the toddler. So again, you'll never know every plant or every poison. You'll never know all their effects. Just check the patient's airway, check their vitals, treat the symptoms, get them to the hospital, bring the plant or the poison with you to the hospital, and just get them there quickly. That's another household plant that's common. Dieffenbachia is a common one. It just causes, problems breathing and stuff like that. It's a common house plant. So